I welcome you to today's briefing, the second in a series of daily updates during which I will share with you the current statistics worldwide, regionally, as well as nationally, and the Ministry of Public Health's ongoing response to the COVID-19 pandemic. These numbers capture the global, regional, and national picture as of this morning, the 26th day of March 2020. First, I wish to thank the general public for voicing their concerns through social media, and I hope that my update will address those burning questions. Since my report yesterday, the number of confirmed cases globally has increased to 423,510, with the number of deaths globally standing at 16,231. In the region of the Americas, the total number of confirmed cases stands at 70,877, with 977 deaths in 48 countries. Guyana still has on record a total number of 5 confirmed COVID-19 cases with 1 death. Number of persons tested to date is 26, with 5 positive and 21 negative. Let me clarify that persons in quarantine are those persons who have been exposed but are not sick. Persons in isolation are those persons who would have been exposed and have tested positive and showing signs and symptoms. We have a number of persons quarantined by the Ministry of Public Health. Under institutional quarantine, there are 31 persons, while the number of persons on home quarantine is 135 persons. There are 4 persons in institutional isolation by the Ministry of Public Health. With regard to our capacity to respond, we currently have 4 facilities ready to provide services to 350 persons. Psychosocial support for all persons is essential, regardless of their status, and we will provide psychosocial support through our psychosocial unit within the Ministry of Public Health with assistance from the Ministry of Social Protection. As of yesterday, 696 calls were received from our hotlines from regions number 2, 3, 4, 5, 6, and 10. Let me take this opportunity to apprise persons who are inquiring about the necessary steps after quarantine or isolation. After the 14 days of quarantine, persons will be evaluated by a medical officer and based on the review, will be cleared or placed on additional days of quarantine. If cleared, they will be reevaluated after 7 days. For those persons in isolation, they will be held for 14 days, after which, if no new symptoms develop within 3 days prior to the 15th day, they will be tested twice within 24 hours. If negative, they will be cleared, but those with positive results will remain in further isolation. It is pertinent to note that both the Ministry of Public Health and the HEOC have received several calls about a positive case from Region 9. I wish to dispel fears with regards to the reports of a positive case being in Region 9. This is not a case for Guyana. The individual in question did not visit Guyana for the last 2 weeks prior to his confirmed status or after it was discovered. We are aware that his relative who operates a business in Letim is under quarantine in Brazil, not Guyana. I repeat, not Guyana. Both individuals are in Brazil. Notwithstanding that, health officials in the Upper Takatu Demerara region have begun contact tracing so that we can address any situation that arises and ensure the safety of the Guyanese population. The Ministry of Communities continues to work closely with the Ministry of Public Health in all the regions in rolling out of the COVID-19 response plan. Let me turn my attention to the contingent that returned from Barbados last night. They were advised before they returned that they will be in quarantine for 14 days upon their arrival. We wish to reiterate that these measures are an effort to protect all of us. All medical services are catered for at our sites. In conclusion, the HEOC continues to make recommendations to the task force as discussed and on actions to be taken in order to curb the spread of this disease. The Ministry of Public Health and the HEOC welcome any recommendations or suggestions from the general public as we all seek to stop the spread of the coronavirus disease. We appeal to persons who think that they may have symptoms of the coronavirus disease to call the hotline or call their physician. Please do not turn up at a health facility. I repeat, should you believe that you have symptoms of the coronavirus disease, kindly call our hotline or call your physician. We continue to ask that persons use the preventative measures, that of social distancing, hand washing, and cough etiquette. In doing so, we will be able to contribute to keeping all of us safe. Thank you.